Hi, welcome back to the office. I'm Dr. David Martino. Today's going to be an extremely important visit for you guys. What we're going to be doing is actually teaching you how to read your x-rays, which is so important, because once you understand what those x-rays mean, you're going to see how it's directly linked to your health. Number two, we're going to go over what health really is. It means a lot of different things to a lot of different people. I'm going to explain to you exactly what health is and how you can easily achieve it. And number three, we're going to be going over the philosophy of chiropractic, what it all means, why chiropractic is so important, and why every family needs to be under chiropractic care no matter what. And with that, you'll be able to achieve 100% health in your life. So what we're going to do next is start off with the philosophy of chiropractic, and then we're going to start going over some x-rays. Okay, so let's get started. Okay guys, so what we're going to do is we're going to get started with the philosophy, so let's get right into it. A lot of people come into this office with already a preconceived idea of what they think chiropractic is. Well, I'm going to explain to you exactly what chiropractic is and why it helps so many people. So in order to do that, we need to kind of lay down the foundation of chiropractic, the foundation of how everything works. Because chiropractic works with the same law and principle that kind of runs this universe, I'm going to explain to you that principle right now. So when it comes to everything in this world, there's an intelligence that's running everything in this world. Wouldn't you agree? What's telling the trees to grow? What's telling the grass to grow? What's making the planets orbit around the sun? There's an intelligence that's in every particle of matter and organizes that matter and keeps it alive, living, and doing its job. The same thing's going on with our body. There's an intelligence within our body right now that's making your heart beat, your lungs breathe, your food be digested. Think about it. When you eat food, dozens of different organs come together to release enzymes and hormones at a very specific time to digest that food. You don't even have to think about it. When you cut your arm, what happens to it? It heals. So your body's a self-healing organism, and it doesn't need any help. It's doing it all on its own. How is it doing that? You don't have to think about it. There's an amazing, omnipotent, all-knowing intelligence that's running your body. And in the universe, we call that universal intelligence. Within our body, we call that innate intelligence. That's the inborn intelligence that built your body and is running your body. What do I mean by that? Built your body? You were made by two cells. Those two cells became one cell. From that point, a whole human body was built in 280 days with no help from anybody. That's a miracle. It's unbelievable. If I took all the smartest men in the world, all the books that were ever written on health, and I took all that knowledge and put it into one person's brain, that person would still not know anything compared to the intelligence that built your body. So do you think we want that intelligence, the intelligence that built our heart, built our lungs, built our liver, all those different things? Do you think we want that intelligence flowing through our body at 100%? Absolutely. So I'm going to show you the first organ that was ever built when you were built. So when you were conceived, the first organ that was ever built was your brain, because your body has to build the master control system to the entire body. So here's the brain. That's the first organ to be developed. All the information on how to heal, function, and operate your entire body and heal your body is stored inside your brain. From that point, from that brain, then the next part of your body that was developed was your spinal cord, which is just a long tail off of your brain. From there, the nerves grew out. Okay? And those nerves, from the end of those nerves, organs started to develop. So then your heart budded, almost like a flower. Your heart was built, then your lungs were built. All different organs were built. So I want you to understand, from when you were conceived, the first organ that was developed was your brain, spinal cord, nerves, heart, lungs, liver, everything was built that way. So I want you to understand, this is the way your body works, receives information, heals, functions, operates. All the information on life and health is stored in your brain. All life, that innate intelligence, all knowing, flows down your spinal cord, which is located in your spine, out over your nerves to every cell, organ, and tissue in your body. So the only reason why my heart's beating, my lungs are breathing, my food's being digested, why is that happening? Because my brain's telling it to do it. Here, I'm going to prove it to you. If you got your head cut off, what would happen to the rest of your body? You would die, right? No brainer. Why would you die? Because 100% life is inside your brain. So if I cut your head off, if 100%'s here and we cut off, what does the rest of your body go to immediately? Zero. So zero is then what? Death. So everything dies. Now people live without arms and legs, right? They can live like that. People exist like that. You can't live without your head, okay? Because your brain is disconnected from your body. Nothing can heal, nothing can work. So we know that that's an extreme case, but let's take it a step further, maybe not as severe. Now, what if we came to the nerve going out to your heart, and I cut that nerve going to your heart, to your lungs, to your liver, to your stomach, any organ? What would immediately happen to those organs? They were functioning at 100%. I just cut it. What did they go to? 0. So what did they do? Immediately, they died. Okay, so let's scale it back a little bit further. What if we came back to the nerve roots right here? The nerve roots are where the nerves are exiting the spine. So they're the kind of the beginning of the nerve going out to the body. So if I start squeezing, crushing, or strangling one of those nerves, putting pressure on it, blocking the information coming from the brain, now we're not getting 100%. Now we might be getting 80% or 70%. If we do that, what's going to start happening to that part of the body? Let's just say it's your heart. The nerve going to the heart starts getting strangled, or to your lungs, or to the muscles of your neck. What's going to happen to those parts of your body over time? Would they get sicker or healthier? They're going to get sicker. Why? If my heart needs all the information to be healthy and it's only getting some of that information, you could see why over time that organ's going to start to lose function. So 100% is health. So as I move away from 100% and start going down, 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 I'm losing function, so I'm losing health. And only at about 60% function will I actually start to feel a symptom. So what do I mean by that? Why is that important? You can have a heart that's functioning at 80% and still feel good. You can have a pancreas that's functioning at 80% and still feel good. Only until you get to about 60% function is when you're going to actually start to feel the problem. So most people are walking around with blocked arteries in their heart, or they might have high blood pressure and not know it. So they're walking around thinking they're healthy, but they're not healthy at all. They might feel good, but feeling good has absolutely nothing to do with how well or how healthy you are. So feeling good, like I said, you could have a gallbladder that's dysfunctioning, lungs that are dysfunctioning, and feel pretty good. And unfortunately, once people start to feel bad, where do they typically go to? Unfortunately, in this country, most people go to the doctor, and when they go to the doctor, the only thing they're really ever offered are two solutions: drugs or surgery. Now, if my pancreas is shutting down, my high blood pressure is up, there's a reason why I have those disorders. There's a reason why I have high blood pressure. If I have headaches, are headaches the cause of my disease or the result of it? Okay? They're the result of it. If I have high blood pressure, is that the cause of my disease or the result of it? It's the result of it. So if I go to the doctor and he just gives me a chemical to cover up the symptom, so I'm just covering up. I'm not getting to the reason why it's there. Do I ever heal from that condition? Do I ever get better? Does my health ever improve? Do I add years to my life by doing that? No, I reduce my lifespan. I just cover up symptoms, put lots of chemicals into my body, and never get to the true source. Now, I'm not saying there's not a reason for some of those things sometimes, but we're overusing those medications in this country. We don't have a healthcare system in this country that's helping people understand their body, understand the laws of principles of how their body was created to work. So that's why chiropractic is so powerful, because when we adjust the spine, we're going to be allowing that information to flow out at 100%. If that information is getting out at 100%, is the body going to be able to be healthy? Absolutely. So let me show you what can actually put pressure on these nerves, shutting down life, health, and to the body. So here's your spine. We obviously could see that the spine must be the most important organ system in our body. Why? Because it's encased in bone. Okay? Now, there's very important things to understand about your spine. Okay? Number one, your spine's supposed to be straight. So if I took a picture of your spine like we did, your spine should be straight up and down. We should see it nice and straight, just like this. From the side, what's even more important are the 3 curves you're supposed to have. One in your lower back, mid-back, and especially this one in your neck. That's the most important one because it's the closest to your brain. So your spine was also created to protect your body. What's it protecting? Your brainstem, which controls all life. Right now, your brainstem's regulating parts of your body like your heart rate, your respiration rate, body and blood temperature, hormone release, all your different hormones, focus control, sleeping patterns. All those different things are being regulated by an area right here that your spine's protecting. Number 2, your spine's protecting your very delicate spinal cord, which is running all the way down your spine, located right inside these bones here. And all these nerves, they're also being protected. These are the nerve roots that we were just talking about that go out to all different parts of your body. This nerve right here goes to your heart. This one here goes to your lungs. These ones here go to your digestive system. So everything's flowing through here. Now, what's important to know is that when your spine is straight and has all the curves like it's supposed to, all the information on life, healing flows from my brain, down my spinal cord, out to every single part of my body at 100%. And as a result of that, would I be healthy or sick? I'm going to be a healthy person if my spine is in line and all the information's flowing out at 100%. Now, conversely, let's just say I got into a car accident, or I fell down when I was young, or I had lots of stress in my life, sitting at desks, walking, carrying bags, all these different sorts of things. What can that start to do to all these different movable joints over time? Now, if I have a hard force coming in, it can shift my spine out abruptly, okay? Now, let's just say over time, whole parts of my spine start to creep out of place. So what's that starting to do? It's starting to shift these bones out of place. That's what chiropractors treat. We treat those shifts in the spine that are caused by just being alive and that start to shut down life. Those shifts in the spine are called subluxations. I want you guys to say that with me, because that's a word we don't really usually hear. So subluxations are when bones shift out of place, start putting pressure on the spine, and then start to shut life off to the rest of our body. So if I'm shutting off the very intelligence that runs my body to different organs in my body, different cells, can those cells ever be 100% healthy? Are they ever going to work properly? No. So what does that mean for you? It means you're not going to work correctly. Your body's not going to work correctly, and you're never going to be able to have the quality of life that you're supposed to have. Most people just cover those symptoms up. What we're in this office, we're looking for the cause and the reason why your body's shutting down. And if you have subluxations, that's definitely a huge contributing factor to why your body's breaking down. So what we're going to do next is show you x-rays and how those x-rays, we're going to be looking at basically your spine. So we're going to show you what those x-rays look like, what normal curves of the spine look like, and how we actually take care of those subluxations, correct them, and get you and your family back on the road to health. So what we're going to do next is we're going to take a look at some x-rays and start having you understand what those x-rays mean. Okay? All right, guys, so what we're going to do is start going over some x-rays. So the first x-ray that I want to show you is a normal view, so you can understand what normal looks like, so we have something to contrast it to. So the most important view that we take in this office that I'm going to be showing you right now is the side view of the neck. The reason why that's the most important is because it's the closest to your brain. So the first view we're going to be looking at is the side view, which is showing us the skull, the jaw, and the curve of the neck. Now, there's three main reasons why we take this x-ray. Number one is for the atlas bone. The atlas bone has to be angled up at 31 degrees. What does that number mean? When the atlas is angled up at 31 degrees, it's keeping all the pressure off the brainstem. The brainstem is the most important and influential part of your spinal cord. So literally, it's controlling function to thousands of different areas of your body. So studies show when that bone is angled up at 31 degrees, there's no pressure on the brainstem, and all the information can flow out to the body the way it's supposed to. Number two, we're looking at it. A huge important reason is for the curve of the neck. The curve of the neck has to be 43 degrees. When the curve is 43 degrees, there's no pressure on the spinal cord, and all the information can flow out to the body at 100%. And lastly, we're going to be looking at the disc spaces that you can see here, these nice black spaces. Those spaces, your discs, are maintaining the hole for the nerve to travel out. So you got the spinal cord, then the nerves are traveling out to the body. When those discs stay nice, big, and healthy, they're allowing the information from the body to flow out at 100%. So if I see somebody who comes into my office and they have a spinal column that looks like this, I know that person's functioning at 100%. Now conversely, let's start looking at what sick spines look like, what diseased spines look like, and how it starts shutting down people's health. So let's start taking a look at that. So we're going to be looking at the phases of degeneration right now. So here we just said, here's a normal curve in the neck. Now you can see there's a nice curve, the discs look great, and that person has a great atlas inclination. So that's a healthy person. Now number two, if somebody starts to lose the curve in their neck, how does that happen? Just through being alive, the stresses of life. Sitting at desk, playing sports, all different sorts of reasons cause our spines to start breaking down. Gravity's always working on us 24 hours a day. So it starts breaking our spine down. So if somebody starts to lose the curve and develop those shifts, which we call subluxations, in their spine, they're going to go to a phase one. Now you could see in a phase one, the spinal cord has straightened out. 96% of people who are in a phase one have zero symptoms. Just like somebody who has an 80% blocked artery in their heart. They're a very sick person, but they don't feel it yet. In a phase one, Most people don't have any symptoms, 96% of the people. So you can see the atlas bone here is also starting to flatten out a little bit. Now you can see over here, this is what a normal spinal cord looks like when you have a nice curve in your neck. Now when you start to lose the curve in your spine, like we see right here, this is what your spinal cord looks like. Think about it. If your spinal cord has a nice curve in it, the spinal column, the spinal cord is actually nice and relaxed. When I lose that curve, I start to stretch the spinal cord like a rubber band. Now think about it. Which cord do you think would be sending better information to the body? One that's relaxed and nice and thick, or one that is being stretched like a rubber band and irritated? Which one do you think is going to be sending more information on life and healing to the body? The thicker one, right? So we can see here, this is the thick one, this is the thinner one. When you have a nice curve, that's a healthy spine, sending all the information to the body. When you lose the curve like you do here, that's what your spinal cord looks like. So that's a sick person. But unfortunately, most people who have that type of curve still have no symptoms, but their body's shutting down, moving towards the disease and degeneration. So now if that person leaves that curve uncorrected like that, if something's in a phase 1 and you don't do anything about it, where do you think it goes to over time? Phase 2. It's not going to go back to normal. It's going to keep progressing. The momentum is pushing it towards degeneration. So eventually, in about 7 to 10 years, you'll end up in a phase 2. Now, when somebody gets to a phase 2, this is when I usually start seeing people in my office. Their spine has been crushed for a very long time. The discs are becoming progressively diseased. As you can see right here, the discs are getting smaller and smaller. So if the discs are getting smaller and smaller, what do you think is happening to the information from the brain going out to the body? That awesome intelligence, what do you think is happening to it getting out to the body? It's being shut down, and the body is getting weaker and sicker. Usually people that come in a phase 2, they're going to usually be on medications. They don't feel good. They're fatigued. They've been to lots of doctors. They can't figure out why. They're thinking, it's just my age. The doctor told me that's just the way it's going to be. No, your body's supposed to last you about 80 to 120 years. But the bottom line is, if the information that built you isn't getting out to you properly, your body's going to weaken, degenerate, and unfortunately, you leave this earth a lot sooner than you're supposed to. So you can see here the discs are shutting down, and the atlas bone is continuing to get flatter. So it's almost like a valve on a hose where it keeps shutting off the life that's going out. As that bone's coming down, it's shutting off the life more and more to the body. So an important thing to note is the discs. The discs are the shock absorbers, okay? So those discs are supposed to be nice, big, thick, and healthy. Now think about it. If the disc gets smaller, it becomes diseased. So think about it. If the disc becomes diseased, what do you think the spinal cord becomes over time? Diseased. And then what do you think the nerve becomes over time if the disc in the spinal cord becomes diseased? It also becomes diseased. And whatever this nerve's attached to, whether it's my heart, my lungs, my liver, anywhere, what do you think that also becomes? Diseased. So see how it's all connected? It's very, very serious. Basically, that subluxation metastasizes and goes into every part of your body and starts shutting down the life force going into your body, causing your body to keep getting weaker and sicker. Now, if somebody's in a phase 2, where do you think phase 2 is going to go to? It's going to go to a phase 3. Phase 3s, nobody here is actually in a phase 3, so don't worry about that. And I'll tell you why. Here, we know that the spine is getting sicker. If it goes into a phase 3, you can see that there's almost no disc spaces whatsoever. The atlas bone is completely flat. So how much information do you think is getting out from the brain to the body? If everything is fused, crushed, and shut down, almost zero. So if no life is getting out to the body, what's happening to the organs and cells that are attached to those nerves? They're getting almost 0% life. So you'll be able to answer the question why I don't see a lot of people that look like this. If this is a healthy person that comes into my office, and then somebody loses that curve and they're now starting to become sicker and weaker, as somebody moves through these phases, they're getting sicker and sicker and sicker. Why would you believe I don't see too many people in a phase 3? There's two main reasons. Either they're dead, or they're on some type of hospice, comfort care at home. They're about to leave, unfortunately leave this earth. Why? Because no information is getting out. You cannot be alive, healthy, and well if your whole spinal column is crushed, blocking the nerves going out to the body. So I want to tell you that the only difference between phase 3 and a normal, healthy spine was just time. Nobody told somebody about how important chiropractic care is. Nobody told them about it. So they just kept letting that phase keep getting worse and worse and worse. So if I could have got to somebody when they were in a phase 1, could I have corrected their curve and added years to their life and kept their body functioning? Absolutely. So the only difference, like I said, is just time. Misalignments uncorrected over time. So that's why I can tell you when somebody's in a phase 3, or if I ever do see them, or in a late stage phase 2, and they learn about this information, they're so aggravated that nobody ever taught them about this because they've been suffering for so long and nobody ever taught them the cause of why this is happening. So now that you understand the phases of degeneration, now you can kind of see what phase you're going to be in when you take a look at your x-rays. I'm going to actually start showing you some actual real case studies of people that came to this office and when they went through our treatment program, how they came out on the other end. So let's take a look at that. But first, what I'm going to do is actually go over Christopher Reeve. This slide popped up, and it's a very important slide, so I want to talk about it real quickly, because we all remember Christopher Reeve. He was Superman. He was my Superman. I know there's been a lot of other ones, since then, but that was the original, one of the original Supermans. Now, if you remember what happened to him, he fell off a horse, and when he fell off the horse, he damaged the first bone in the neck, which we call the what? The atlas bone. So when he damaged that atlas bone, his atlas bone went from 31 degrees down to 0 almost immediately and just pushed a tiny bit of damage into his actual brainstem. Now, when he did that, what did he become? Paralyzed. He needed a pacemaker for his heart, a respirator for his lungs. People used to have to push on his stomach and move his bowels into a colostomy bag. Think about that. Did he fall on his heart? Did he fall on his lungs? Did he fall on his stomach? No, he fell right here. But when he fell right there and he shut down that atlas, what started happening to the life, the information and intelligence? Could it get out to those organs? Nope. So what ended up happening to those organs? They started to die. They shut down by 70% and ultimately led to a very, very early death. He was kept alive by machines and crisis care type stuff, but ultimately him crushing his spinal cord shut down his life way, way faster than what it was supposed to. So that's why we take it so seriously. If I see somebody's atlas bone that even comes down just a few degrees, what do I know is happening to their health? Whether or not they feel it or not, they're building disease cells in their body and their body's getting weaker and sicker. Okay, so I just wanted to show you that slide there. Now we're going to actually start looking at some case studies. So let's take a look at that. Okay, this is Jack. Jack came into the office with pain shooting down his arm. He was having headaches all the time. He was actually on a beta blocker for his heart because he had high blood pressure and an arrhythmia. So I took a look at his spine. When we took his x-rays, he had no curve in his neck. As you can see right there, 0 degrees out of the possible 43. His atlas bone is supposed to be up at 31 degrees. His was only up at 27. So Jack was not working well. The intelligence was not getting out to his body. So I started seeing him 3 times a week. I want to explain to you why somebody has to come in here 3 times a week very, very quickly. Just like if you were going to the gym, you would have to go often to start making results. Every adjustment you get, every therapy session that you go through builds on the next. If you have no curve in your neck, we can't see you once every few months. We have to see you repeatedly to start creating momentum and start to correct the curve in the spine, just like going to the gym. To get results, you have to repeat those habits. So he came in 3 times a week for 2 months. After that, we met with him. We looked over his x-rays again. He was doing much better. His curve was correcting. And then we saw him 2 times a week for the next 2 months, so a total of 40 visits. At the end of 40 visits, this is what his spine looked like. You could see his spinal curve corrected from 0 to 40 out of 43. His atlas bone went up to 30 degrees out of a possible 31. So a huge amount of pressure was taken off his spinal cord. Life and information was restored out to his body. And as a result of that, he was off his beta blocker. His headaches were completely gone. And the pain that was going down his arm was 100% gone. All because we took pressure off of his cord and his body was allowed to communicate better. So just an amazing story. So now let's take a look at another case right here. Okay, here's Mark. Let me tell you a little about his story before he actually came into this office. Mark had pain shooting down his legs. He'd been going to doctors for years, taking all different sorts of pain medication. Finally, his kidneys actually started shutting down from taking so many Advil and pain medication that he actually had to go to a nephrologist, and they actually had to place a kidney catheter that you can actually see on this x-ray. I'll talk a little bit more about that, into his right kidney to help drain his kidney into his bladder. He couldn't take the medication any longer because it was shutting down his kidneys, but he still had a huge amount of back pain, couldn't go to work, so he actually got referred into this office for his back pain. So when he came into the office, Mark was scared. You know, the guy had a kidney catheter, his kidneys were failing, and I said, well, let's take some pictures of your spine, just like we took on you, and let's see if you have any subluxations that are blocking health from getting out to your body, blocking that information. So when I took a picture of Mark's spine, you could see right here, it's supposed to be straight up and down. You could see that it's shifted off. He's got a 10-degree curve going to the right here. So what was happening, those nerves were getting crushed, going out to his kidneys, to his lower back, causing all sorts of dysfunction. So I said, let's start treating you. I started treating him 3 times a week for about 2 months. At the end of 2 months, we took a new set of x-rays. His spinal curve was starting to correct. I then knocked him down to 2 times a week for the next 2 months. And this is what his spine looked like at the end of 4 months total and 40 visits. Is it completely straight? It's 100% completely straight. He completely corrected his 10-degree curve, completely got all the pressure off of his nerves. So how was he feeling there? If he was a sick person here with those nerves getting crushed, what do you think he was? His body's health had rejuvenated, his health turned back on, and at this point, his lower back pain was 100% gone. And what's amazing, one of the most amazing things that happened here, I don't treat any of those things. I don't treat back pain, kidney problems, anything, just subluxations in the spine. But what was actually amazing is when he went back to his doctor was so impressed with his kidney function that they were able to remove the catheter because his kidney function went up to about 80%, which is just absolutely amazing. So the whole biography of this gentleman's life was changed. His kidney catheter got removed, his pain in his back was removed, he was able to go back to work, didn't have to be on medications, just covering up symptoms as his body kept getting weaker and sicker. So now he just comes in for maintenance care, and it's just an unbelievable story. So now what we're going to do is talk to you a little bit about children. You know, so many people ask me, new patients when they come in the office, why there's so many children here, why so many families are coming in here. They ask me, why are little kids getting adjusted all the time? And it's simple. Children have the exact same, spines as we do, except smaller. When do you think these subluxations start? Sometimes at birth, before they even take their first breath. Kids are getting pulled out of the birthing canal, already damaging bones in their neck and their spine before they even took their first breath. Now, as you can see from this slide, kids are on cell phones, they're having injuries, they're falling down on average between the ages of 1 and 5, 25 times a day. Do you think that can shift the bones in their spine out, blocking intelligence getting out to their body? Absolutely, 100%. That's why it's mandatory that all children come into this office and get checked out. So if you become a patient here, we're going to ask you to bring your kids in to at least get checked so we can see if there's any damage in their spine that's going to basically ruin their life as they get older. So we want to correct that now, keep them under care now, so later on in life they can have an abundance of health in the life that they were created to have. Avoid drugs, avoid medication, and just have the beautiful life that they were intended to. So we're going to ask you to bring them in just to get checked out. And if they do have any damage, we can correct it, and everything will be great. So what I want to do now is recap on everything that we just went over. Okay, so right now, one of the doctors or myself are going to come in to go over your x-rays. So let's go over what we're going to be looking at. So again, remember, the atlas bone's supposed to be up at 31 degrees. If it is not, your body cannot be healthy, will not be healthy. Also, the curve of your neck is supposed to be at 43 degrees. So when we take a look at your x-rays, we're supposed to see a 43-degree curve and a 31-degree atlas. If we don't see that, what's happening to your body? Is it getting sicker or healthier? Sicker. If you continue to leave abnormal curves and subluxations in your spine, what's going to continue to happen to your body? It's going to keep getting weaker and sicker. And what does that mean for you? A quality of life that you do not want to have, medications in your future, disease. We don't want that for ourselves or our family. So if you see any of that damage there, what do you got to do? You got to make the change now. You have to start taking control now. And that's really what it is. We have 3 requirements to be a patient in here in this office. Number 1, you have to be committed. I can't force you to come here. I can't make you do anything. You have to be committed to taking care of yourself, taking care of the problem. Because if you do, it means everything for you and your family. And you can start to mold your future into the future you want it to be. Number 2, if you have any children, we're going to need to bring them in to get them checked out so they can have the amazing life that they're supposed to. And number 3, pretty much, our job here is to teach people about the principle and laws of how the body was created to work. So we do a dinner once a month, and if there's anybody that you're thinking about Anybody that you know is suffering and maybe they don't think there's any other way for them, they don't think there's any other hope for them, we're going to ask you to bring them out to that dinner, invite them out to that dinner so we can teach them the same principles that we taught you here today, and maybe we can help them. But today's about you. It's time for you guys to take action now. Start correcting your spine now. It'll literally change the rest of your entire life, the history of your life. So I just want to thank you so much for allowing me to speak with you for this short amount of time. And what's going to happen next is somebody's going to come in and go over your x-rays. Okay, guys. Thanks a lot.